Place your hand flat on your belly right now. Go ahead and do it. Press gently, just below your navel, and take a slow, deep breath in. Feel what happens. Feel how your abdomen expands. Now let it out slowly. Do it one more time. Breathe in, feel it rise. Breathe out. I want you to sit with that feeling for just a moment, because what you just felt is not simply air and tissue. What you just felt is something that has been changing inside your body for years, quietly, without your permission, for reasons that have almost nothing to do with what you eat or how much you move. And today I am going to tell you exactly why. If you are over 60 and you have tried cutting back on food, tried walking every morning, tried cutting out sugar, tried every reasonable thing you can think of, and that belly is still there, I need you to hear this clearly. It is not your fault. That is not a comforting phrase. It is a clinical statement based on peer-reviewed science that most primary care physicians simply do not have the time to explain during a 15-minute appointment. What is happening in your abdomen after 60 is a biological event driven by hormonal shifts, metabolic changes, and cellular aging processes that are distinct from the kind of fat accumulation that affects younger people. The rules genuinely change, and if you keep applying the rules from your 40s to your body at 65, you will keep getting frustrated because you are solving the wrong problem. I had a patient named Gloria. She was 68 years old, retired bookkeeper from Georgia, sharp as anyone I have ever spoken with. She came to see me not because she felt sick, but because she was quietly devastated. She had gained roughly 12 pounds around her midsection over the previous 4 years without any meaningful change in her diet. She was eating less than she had in her 50s. She was walking 45 minutes every single day. Her annual blood work always came back within normal limits. Every doctor she had seen looked at her numbers, looked at her, and said the same thing: eat a little less, move a little more. She looked at me across my desk and said, "Doctor, I do not know what more I can do." She was not looking for excuses. She was looking for an explanation. And the explanation she deserved was the one I am going to give you today. My name is Dr. James Harlow. I have spent over 25 years in internal medicine with a specific clinical focus on the intersection of nutrition, hormonal aging, and metabolic health in adults over 60. What I do in this practice, and what I try to do with every video on this channel, is give you the clinical truth that busy doctors rarely have time to sit down and explain. Today, that truth is this: the biology of belly fat changes dramatically after 60, and understanding that change is the first step toward actually doing something about it. Before I get into the 6 biological reasons your belly behaves differently after 60, I need to tell you about what we are covering next. In our upcoming video, I'm going to walk you through why your memory and focus begin to shift after 60, and specifically the brain mechanism behind it that most people confuse with early Alzheimer's, when it is actually something else entirely, and something that can be addressed directly. That video could genuinely change how you think about what is happening in your mind, and you will want to see it before you start worrying. If you are not yet subscribed to this channel, please take a moment right now and hit that subscribe button and tap the bell so you do not miss it. Now let us get into this. Reason number 6, your cortisol is running high, and your fat cells already know it. Cortisol is your primary stress hormone. It is released by your adrenal glands in response to perceived threat, and in small doses it is essential for survival. The problem is that as we age, the mechanism that dials cortisol back down after a stressor becomes less efficient. A large cross-sectional analysis published in the journal Obesity, involving more than 2,500 men and women aged 54 and older, found that people with higher long-term cortisol exposure were significantly more likely to carry persistent abdominal weight, and the association held even after controlling for diet and activity levels. This is not a minor effect. Visceral fat cells, the deep abdominal fat that surrounds your organs, contain a disproportionately high number of cortisol receptors compared to fat cells anywhere else in the body. When cortisol stays elevated, those receptors essentially send a signal to that region to hold on to fat and accumulate more of it. This is why the belly is often the last place to respond to diet changes, even when other areas of the body do respond. The fat there is biologically locked in by a hormonal signal that standard dietary advice simply does not address. Gloria described herself as a generally calm person, but she had been caring for a sick husband for 2 years before she came to see me. Chronic, low-grade stress, even the kind you adapt to, is enough to keep cortisol measurably elevated in someone over 60. Reason number 5, your sleep quality has changed, and that is directly reshaping your abdomen. Most people over 60 notice that sleep is lighter, less restorative, and more fragmented. They assume it is just aging. What they do not realize is that the quality of your deep sleep directly regulates both cortisol and a fat-mobilizing hormone called growth hormone. Growth hormone is released in pulses during the deepest stages of sleep, and it is one of the few hormones that actively signals the body to break down stored fat and build lean tissue. A study published in the Journal of Clinical Endocrinology and Metabolism found that for every decade of life after 20, spontaneous growth hormone release declines by approximately 14%. By the time someone is 65, their overnight growth hormone output is a fraction of what it was at 40. And here is where sleep and belly fat intersect directly. The deeper stages of sleep that trigger growth hormone release are the first stages to disappear with age-related sleep disruption. Poor sleep also raises morning cortisol, creating a compounding effect where less growth hormone and more cortisol are both signaling the same destination: visceral fat storage. If you are waking at 3 in the morning, sleeping lightly, or getting fewer than 6 hours consistently, your belly is receiving biological instructions to hold on to its fat through the night rather than releasing it. Reason number 4, you are losing muscle, and muscle is your metabolic engine. Beginning around the age of 30, the human body starts to gradually lose skeletal muscle mass. But after 60, the process accelerates in a phenomenon clinicians call sarcopenia. A 2022 review published in the Journal of Cachexia, Sarcopenia, and Muscle found that adults over 60 can lose 3 to 5% of their muscle mass per decade, with that rate increasing after 70. The reason this matters for belly fat specifically is that muscle is metabolically active tissue. A pound of muscle burns significantly more calories at rest than a pound of fat. When muscle mass declines, your resting metabolic rate drops, meaning you burn fewer calories doing nothing, even if your activity level and food intake stay the same. The calories that previously fueled your muscle metabolism now have nowhere to go, and the body, following its ancient survival programming, deposits them as visceral fat. The Korean Sarcopenic Obesity Study, a prospective cohort analysis of over 800 adults, demonstrated directly that sarcopenic individuals, meaning those with low muscle mass paired with high visceral fat, showed the highest rates of insulin resistance and metabolic dysfunction of any group studied. This is not a lifestyle problem. It is a physiological progression that requires a specific response, which I will give you in the action protocol shortly. Reason number 3, the hormonal landscape of your body has fundamentally shifted. For women, the drop in estrogen during and after menopause is one of the most powerful drivers of visceral fat accumulation that exists in human physiology. A review published in the journal Menopause and the Cardiovascular Disease Risk in 2022 found that postmenopausal women accumulate 49% greater intra-abdominal fat area compared to premenopausal women with otherwise similar lifestyle profiles. Estrogen actively suppresses visceral fat storage and promotes the storage of fat in subcutaneous areas, meaning beneath the skin at the hips and thighs, rather than deep in the abdomen. When estrogen levels fall after menopause, that protective effect disappears, and fat redistribution moves inward. For men, the equivalent shift is the gradual decline of testosterone. Low testosterone accelerates the conversion of calories into visceral fat rather than lean tissue, reduces motivation to exercise, and creates an environment where the belly grows even in men who are otherwise health conscious. A cross-sectional study published in Obesity Reviews found that men with low testosterone had significantly greater visceral adipose tissue volumes than age-matched men with normal testosterone levels, independent of body mass index. These are not lifestyle failures. These are endocrine events that unfold silently over years and cannot be undone by walking more often. Reason number 2, your insulin sensitivity has declined and your cells are no longer speaking the same language. Insulin is the hormone that escorts glucose from your bloodstream into your cells to be used as energy. In a healthy young metabolism, this process is efficient and responsive. After 60, and particularly in the presence of the muscle loss and hormonal changes already described, the cells of your body become less responsive to insulin's signal. This is called insulin resistance. A comprehensive analysis using data from the National Health and Nutrition Examination Survey, involving thousands of adults across age groups, found that insulin sensitivity declines progressively with age, and that the decline accelerates significantly after 60, particularly in the presence of abdominal adiposity. What this means practically is that after a meal, your body needs to release more insulin than it used to in order to accomplish the same job. That excess insulin is a fat storage signal. It instructs fat cells to take up more circulating energy and hold on to it. And because visceral fat cells are both more metabolically active and more insulin responsive than peripheral fat cells, they are the ones that grow. This creates a self-reinforcing cycle. More visceral fat makes the cells more insulin resistant, which causes more insulin release, which drives more visceral fat accumulation. Breaking that cycle is possible, but it requires understanding it first. Reason number 1, and this is the one that most doctors never mention, your gut microbiome has aged alongside you, and it is no longer managing fat the same way. The trillions of bacteria living in your gut are not passive passengers. They produce metabolites that directly influence your metabolism, your inflammation levels, your insulin sensitivity, and your ability to extract and store energy from food. As we age, the diversity of the gut microbiome decreases substantially. A 2024 review published in the journal Cell, Host, and Microbe found that aging is associated with a marked reduction in beneficial bacteria, particularly species that produce a compound called butyrate, a short-chain fatty acid that plays a direct role in regulating inflammation, gut barrier integrity, and fat metabolism. When butyrate-producing bacteria decline, gut permeability often increases, meaning more inflammatory compounds from the gut can enter the bloodstream. That low-grade systemic inflammation, sometimes called inflammaging by researchers, directly promotes visceral fat accumulation and makes the body more resistant to fat mobilization. A 2021 study published in Nature Aging found that the gut microbiome pattern in adults over 60 was one of the strongest predictors of metabolic health and survival over a 10-year follow-up period, more predictive than dietary intake alone. The gut is not a separate issue from belly fat after 60. It is one of the primary drivers of it. If you have been watching this and recognizing yourself in these 6 reasons, I want you to stop right now and leave a comment below, telling me which one surprised you the most. Was it the cortisol connection, the gut microbiome, the growth hormone and sleep relationship? Your comment helps me understand what to cover next, and I read every single one. And if you have not subscribed yet, please do that now. Because the video I mentioned at the start, the one about what is actually happening to memory and focus after 60, and why it is often not what people fear, that video is coming very soon, and you will want to see it. Now let us talk about who is most at risk for accelerated visceral fat accumulation, because not everyone over 60 is equally affected, and knowing whether you fall into a high-risk category changes what you need to prioritize. Women who have completed menopause, particularly those who went through it before the age of 50, face the most significant risk due to the early and prolonged loss of estrogen's protective effect. Men with clinically low testosterone, which is increasingly common and frequently undiagnosed in men over 65, face a parallel risk profile. Adults who sleep fewer than 6 hours per night or who have untreated sleep apnea are simultaneously losing growth hormone output and elevating cortisol, making visceral fat reduction functionally impossible without addressing the sleep issue first. Individuals under chronic psychological stress, including caregivers, those dealing with financial pressure, or people managing long-term grief or anxiety, are running elevated cortisol in a sustained way that directly feeds visceral fat accumulation, regardless of diet. And certain medications commonly prescribed to older adults deserve attention here. Long-term use of corticosteroids, including prednisone, directly mimics elevated cortisol and drives abdominal fat. Some antidepressants in the SSRI, and particularly the atypical antipsychotic categories, have been associated with weight gain concentrated in the midsection. If you are on either of these classes of medication and have noticed unexplained abdominal changes, that is a conversation to have with your prescribing physician. I am not suggesting you stop any medication. I am suggesting you understand all the variables at play. Now let us move to what you can actually do, because understanding the biology without action is just information, and I want to give you something you can begin this week. Step 1. Prioritize sleep as a metabolic intervention, not merely a comfort issue. The research is unambiguous. Deep, restorative sleep is when growth hormone is released and when cortisol is regulated. Getting to bed at a consistent time, keeping the room cool and dark, avoiding bright screens for 60 minutes before bed, and addressing any underlying sleep apnea if it has been suspected but not evaluated are not suggestions for feeling better in the morning. They are direct interventions in the hormonal environment that governs visceral fat storage. If you can shift from 6 hours of fragmented sleep to 7.5 hours of more consolidated sleep, the downstream effects on cortisol and growth hormone are measurable within weeks. Step 2. Introduce resistance activity, specifically targeting muscle preservation. Walking is genuinely good for cardiovascular health and mental well-being, but it does not adequately counter sarcopenia. The research consistently shows that resistance training, which can mean bodyweight exercises, resistance bands, or light weights performed with sufficient effort, is the most effective intervention for preserving and rebuilding the metabolically active muscle mass that keeps resting metabolism from declining. You do not need a gym. You need consistent effort against resistance 2 to 3 times per week. If you have joint limitations, chair-based resistance exercises and water-based resistance training are both well-studied alternatives with documented benefits for muscle preservation in older adults. Step 3. Shift your eating window without necessarily reducing total calories. This is one of the clearest interventions for improving insulin sensitivity in older adults. A study published in Cell Metabolism found that restricting eating to a consistent 8 to 10 hour window each day, such as from 8 in the morning to 6 in the evening, improved insulin sensitivity, reduced fasting glucose, and was associated with reductions in visceral fat volume, even without any change in the types of food consumed. This works because it gives the body an extended period without insulin stimulation, which allows cells to reset their sensitivity to the hormone. You are not starving, you are timing. Step 4. Eat specifically for gut microbiome diversity. This means incorporating fermented foods, including plain yogurt, kefir, sauerkraut, or kimchi, into your daily intake, and increasing dietary fiber from varied sources. Legumes, cooked and cooled potatoes, oats, and a wide variety of vegetables are all prebiotic sources that feed the butyrate-producing bacteria that aging depletes. A 6-month dietary intervention study published in Cell found that a diet higher in fermented foods produced measurable increases in gut microbiome diversity and significant reductions in inflammatory markers in adults over 60. This is not a supplement strategy. It is a food strategy with solid clinical backing. Step 5. Take the cortisol conversation seriously. If you are under sustained stress, that stress is directly feeding your visceral fat regardless of every other step you take. This means identifying the primary sources of chronic stress in your life and addressing them with the same seriousness you would apply to a medical problem. Because in the context of visceral fat accumulation in older adults, chronic cortisol elevation is a medical problem. Mindfulness-based practices, including structured breathing, have been shown in randomized controlled trials to measurably reduce cortisol awakening response, the morning spike in cortisol that sets the metabolic tone for the entire day. Spending 10 minutes in the morning in quiet, slow breathing before engaging with news, phones, or demands is not a luxury. It is physiology. Gloria came back to see me 8 months after our first conversation. She had made 3 of these 5 changes: prioritizing sleep, adding resistance bands 3 times a week, and shifting her eating window. She had not gone on a diet. She had not changed the foods she loved. She had lost 4 inches from her waist measurement and told me she felt, for the first time in years, like her body was working with her instead of against her. That is what understanding the biology actually makes possible. If this video gave you something you did not know before today, I want to ask you to share it with someone who needs to hear it. A spouse, a sibling, a friend who has been quietly frustrated with the same problem and blaming themselves. Send it to them today. That information costs nothing to pass along, and it could genuinely change the conversation they have with their own doctor. Subscribe to this channel if you have not already, because we are just getting started. The next video, the one about memory, focus, and the brain mechanism after 60 that most people mistake for the early signs of Alzheimer's, is coming soon, and it is something you will want to watch before you spend another day worrying about something that may have a completely different explanation. And leave me a comment right now answering this question. Have you been told by a doctor to simply eat less and exercise more when your belly would not respond? And how did that make you feel? I want to know. I read every comment on this channel, every one. I am Dr. James Harlow. Take care of your health. I will see you in the next video.